Nice to be here. Warmly welcome to this presentation. It's a I'm freezing. I'm sorry, but it's life. My background is I'm a medical doctor. I'm a psychotherapist. I'm trained in CBT, and this presentation is about the thesis work of my therapy training, and it's about seeing the psychedelic-assisted therapies from the viewpoint of CBT, exploring commonalities and differences. I have done 1 year additional training about psychedelic-assisted therapies in the IPA Institute in US, and that's kind of the one reflection point for this work. I work currently in adult psychiatry. I practice as a psychotherapist, and I'm going to start to work as a research therapist in the alcohol clinical trial that was presented. And I love how these presentations are interconnected here. So there will be some similar things and hopefully some new perspectives as well. And I have no commercial disclosures. Aims of this presentation are to explore psychedelic-assisted therapies as a therapeutic process and see what is common and what is different from the viewpoint of CBT. As a general introduction, there are many different ways to describe psychedelic. These have been explored earlier today, and we can classify psychedelics different way. One way to see them as a serotonin-like molecules, especially in the category of classic psychedelics, DMT, LSD, mescaline, and psilocybin. And atypical psychedelics refer to molecules that basically have slightly or a lot different mechanisms of action. And they have different safety profiles. Usually classical psychedelics are regarded as not toxic and not addictive. Most common adverse effects are experiences that can be really challenging, intensely unpleasant, or difficult to integrate. But those are usually limited in time, and the probability of those challenging experiences depends on contextual factors that's referred as set and setting. Most common physical adverse effects are rise in heart rate, blood pressure, also can be nausea, fatigue, and headache. And in modern psychedelic studies, we have no observation of psychotic reactions that would be in prolonged or residual states with alterations in, for example, visual perception. Psychotic illnesses, bipolar disorder, there have been contraindications in modern studies because psychotic reactions are possible in people with predisposition. If we talk about shaping the psychedelic is as they are non-specific amplifiers. That means they increase sensitivity to contextual factors that could be internal and external. And therapeutic and safe use of psychedelics calls, therefore, proper preparation and favorable conditions. And that's the word pair, set, and setting. Client's internal world of experience, including expectations, intentions, beliefs, previous life experiences, psychological structures, and factors related to that. And setting is the external context of therapy session, like presence of the therapist, physical environment, sense of safety and trust in therapy relationship. And if we want to understand psychedelics action, we have to look at it on different levels. Biochemical level reveals increased structural and functional plasticity of the central nervous system. Neurological level reveals increased cortical entropy, and that means different brain regions and networks are talking to each other in much more diverse ways. On a psychological level, we discover an altered state of consciousness, and therapeutically desirable aspects are increased experientiality, wonder, and softening of the boundaries of self-experience. There is flexibility, malleability. On cognitive level, we discover flexibility of thinking, increased insight, and increased sense of meaning. On social level, we see increased experiences of empathy, connection, and community, but also sensitivity to suggestion. This is a classical picture. It's from an MRI study with placebo group receiving IV infusion of saline water and psilocybin on other group. And from the image you can see which one got which one. On the circle you see different brain areas, and the lines are talking or activity between the different brain regions. And this is basically visualization of cortical entropy. There is increased connectivity and very diverse discussion going on. Psychedelic-assisted psychotherapy is a treatment which utilizes pharmacological agent to induce altered states of consciousness in a limited number of therapy sessions. Patient experiences are limited in time, altered states of consciousness, which has increased potential for change. And those windows of opportunity or plasticity are held in safe and therapeutic container, co-created and supported by the therapist. And if we talk about classical psychedelics, most modern research is about psilocybin for depression, anxiety, and substance use disorders. And in atypical psychedelics, most research is about MDMA for PTSD and ketamine for depression. But the research is really blooming. We have very rich avenues with different medicines and different indications going on at the moment. And based on systematic reviews on current research we have available, usually 2/3 of patients receive a clinically significant response for psychedelic therapies. This is an overall view from my thesis work. It divides the process in different parts. First one is screening and patient selection. It's about assessment of health status and readiness to work, safety of the treatment, suitability, and description of what's going to happen, what is the process like, what will happen, and acquiring informed consent. The next part is preparation for treatment, like what is this suffering about, what is the baseline, what is the problem, how can we build the trust and cooperation in the therapeutic relationship, going over the key principles and special features of psychedelic-assisted work, and supporting skills in mindfulness and coping with anxiety. The next part is the psychedelic-assisted work. It can vary from 3 to 8 hours, depending on the psychedelic. The third client's focus is on experiencing and accepting, and the session can be facilitated and supported by music. And there is option for therapeutic touch. It needs to be pre-negotiated and to have consent as well. How will it be applied? The integration path is usually 3 sessions per 1 psychedelic session. That's at least quite common in modern research, but it can be something else when we have these treatments available. I would rather see it as on demand, like, okay, we need to have more integration sessions or more psychedelic sessions. I feel like it shouldn't be maybe fixed, but go on demand. But the point is to explore the experience, the insights, validate emotions, explore different tensions, conflicts, broaden the range of different behaviors available, supporting self-care and enactment of values. And that cycle can be repeated. Experientiality. Learning takes place via the first-hand experience. That's really important aspect of this work. Another guiding principle is cultivating accepting, curious, non-judgmental attitude towards any experience that rises in the experience. Supporting clients' agency, that means orientation towards innate potential of discovering resources, insights, healing. Some frameworks represent this as an inner healer, but I understand it's more like about supporting the sense of agency and discovery of resources. And it can be worded in different ways, or the viewpoint can be different. And also supporting trust in the recovery process, that it will be self-directing and unfold optimally, even though it may look very surprising and non-linear from the viewpoint of external observer. Common elements with CBT from the behavioral perspective, it's about modeling secure attachment, supporting confidential, warm, collaborative, therapeutic relationship, utilizing principles of operant learning. That means basically learning by consequences. When I do this, this happens, and it's something that's supportive or adaptive. Broadening the range of behaviors, that means creating flexibility, dismantling experiential avoidance. That's kind of undoing the tendency to not meet emotions or sensations, but kind of reform the relationship in a more adaptive way. Prolonged exposure and context-sensitive behavior. And like Max presented this a few hours ago, it is like different wordings from the general elements, and this is the kind of CBT language we're going through here. From the cognitive methods, one is cognitive reframing. That means discovering what is the viewpoint exactly, what are the assumptions behind this viewpoint, what are the beliefs there, and if I look with this specific lens, what does it reveal? Is it helpful for me? Can I change it? It's basically creating flexibility in how we reframe and think and perceive things, and making those assumptions more visible. Relational work means how can we be in adaptive way with the different parts of ourselves, and also in a social context. How do we relate each other in a way that's helpful and functional? And usually images visualization happens very easily with psychedelics. It can be something very interesting compared to talk therapy. Third wave in CBT refers to the basically last 10 or 15 years, with more emphasis on curious, open, non-pathologizing position, more sense of experientiality and process-based approach, which means basically focusing on underlying processes of change and healing instead of specific techniques or protocols, being more flexible, and also bringing the understanding that there is kind of sense of multiplicity and different aspects to the mind. And schema therapy is one way to word these. And I notice also in psychedelic research, IFS, internal family systems, is quite popular. And in the CBT framework, the same language can be found from schema therapy, like understanding that, okay, there is this part of me that's vulnerable child, playful child, critical adult, protective adult, healthy adult. And that actually same goes to the trauma therapy frameworks. Differences from CBT, obviously inducing and working with altered states of consciousness. The therapy sessions are long, with ketamine usually 3 hours, MDMA, psilocybin 6 to 8 hours. There is this distinct orientation towards innate potential of healing or insight or resources. There is high probability for mystical experience during the therapeutic process, which could be probably described as a specific subset of altered states that has profound implications for the well-being. or that's at least the hypothesis. And Samuli had done amazing summary on that topic, and it's kind of supporting that the mystical is in contact with that. There is option for therapeutic touch, and utilizing music in therapy sessions is also possible. And transpersonal psychology refers to way that extraordinary or altered experiences can see something that's actually valuable, and it's something part of our potential as a human beings to experience, and they can be cherished and see something as important. And there is increased vulnerability and sensitivity to suggestion from clients' perspective. On that basis, ethical remarks, psychedelic therapy really requires ethical, professional and respectful approach because of the increased vulnerability and sensitivity to suggestion. And also therapists must be mindful not to project one's expectations or ontological assumptions to the client's experience. Spectrum of psychedelic experience can be very wide-ranging, so validating non-judgmental and curious attitude is crucial. And if therapeutic touch is utilized, it requires informed consent and pre-agreed practices. Thank you for your attention.
Thank you very much, Oskari. Yes, we do have time for a few questions.
Thank you, Oskari. My question is, I happen to know that you do also a lot of like body work and you believe in body work, and this was like kind of like really top-down kind of approach. Of course, there's the element of inner healer, and then the body will do in a session what the body wants to do. But would you see that it would be important in the future to also kind of like in a preparation, in integration, to try to find, hopefully from the patient that they would, or clients, that they would kind of find the ways to get the body also there, and to ways to, like, let's say you have suppressed anger or your boundaries have been crossed. It's really important to get this kind of like experience to also your body and nervous system, that you can push something. And like, would you want to collaborate on that?
Thank you. It's a great question. It's more elaborate. In my thesis work, I had to kind of leave stuff out, but one part mentions that, especially in the integration, it's really helpful to also explore the bodily sensations. Is there some kind of movement? How do I feel in my system? And also, can we introduce some physical exercises in my daily routines? It could be yoga, it could be some dance, or something that we do with our bodies, so the inside sensed. And that's really important part of the work. Yeah, thank you.
Questions, comments? If not immediately, I will ask one. Some researchers recently have suggested more direct combinations of using psychedelics with already existing CBT approaches, like directly using exactly the same CBT short-term therapies and then just adding psychedelics. What do you think? Can you think of some sort of short-term CBT interventions where this could work, for example?
This is kind of the overall view, because I was kind of contrasting the CBT training with the psychedelic training and psychedelic research, and I would be really curious to see different kind of researches, like Max mentioned, utilizing different therapeutic settings. Like, okay, if we have ACT-based intervention with psychedelics, would it be beneficial for patients? Or but I think because the psychedelics tend to increase the flexibility, I see short interventions around ACT would probably be something really interesting to explore. Yeah, that would be my recommendation, maybe.
Thanks. Another question in the back.
One of my favorite topics is cognitive flexibility, and I got this question by myself fairly recently, and I would like to hear your thoughts about it. is there a possibility for too much cognitive flexibility?
Ooh, that's a tricky one. Well, the definition of cognitive flexibility is to be able to meet stressors in adaptive way. So by that definition, I'm not sure if you can be too adaptive in a sense, but I think one thing might be, how do you create structures? How do you create groundedness? If there's really fluid states that you can really easily transform or change the patterns, how can you create continuity and sense of stability? I think that might be something related to your question. And I feel that kind of emphasizes if you're seeking like psychedelic experience on very intense frequency, there is this hunger for new experience and yet another discovery and so on. It can lead to tendency to kind of neglect the integration work. How do the wheels hit the road? How do I put these insights into practice? How do I make them in a change of actual my behaviors and patterns in my daily routines and life? Yeah, thank you. Great question.
Thanks. Questions, comments?
Thank you, Oskari. A question, what do you think about more neurotic patients that have this strong need for control, and they might, as Stanislav Graf as well put it, like might resist higher doses of psychedelics as well, which is my experience working with psychiatric patients. Some people resist treatment really, really strongly and resist releasing emotions and so forth. Do you think, from a CBT point of view, would it be more wise to increase the sessions before the trips, or would it be more wise to add additional trips in order to kind of break down, I'm using like citation marks, but break down these strong defenses of or this need for control? Thank you.
Thank you. I think the key aspect in psychedelic work is that there is this sense of safety, that I feel safe enough so I can release the sense of control, or I can release this pattern I've been doing so long time, and kind of psychedelics support that. And I would not try to break down the defenses, but kind of make friends with them and cooperate and work alongside with them by understanding that, okay, they're serving a function, they're supporting, they're trying to help me, but the cost is that it's also keeping me stuck in some way, and kind of creating a supportive container for that kind of exploration. And I wouldn't try either rush the therapeutic process. It takes time, and it cannot be kind of dictated that, okay, you have 3 sessions for your healing, or it just, yeah, it requires time and patience, and it goes on its own pace.
Thanks. One last question here.
Maybe related to Jannika's questions, there's some evidence or some showing that especially with psychedelics or psilocybin, in a big 5, like your openness will like really increase. Can your openness increase too much? Like, let's say you're too open to experiences, or you're too eager to, I don't know. Can your openness increase too much?
What is your intuition on that question?
Well, I think if you're already really open and you get even more open, and I think you could like really get to this kind of like a acid Jesus kind of like a path, or that like, I don't know, to like really bypass maybe the shadows or something. I don't know.
Yeah, thank you. I'm alongside those those lines of thought. Like openness is like I'm willing and able to kind of entertain different ideas and aspects and experiences, but I think it requires pairing with wisdom and with a kind of common sense. it requires different set of skills to support it in a way that's helpful, adaptive. Because if you have only one trait to the maximum, it can be like unbalanced quite easily. And I see it could lead into maybe paranoia or delusional thinking or like things that it's harder to run the daily life. Or the concrete aspects are lacking behind. Yeah, thank you.
All right. Thank you once again, Oskari.